With his education, fellowship training, and surgical skills, Dr. Greg Poulter could practice spine surgery anywhere in the country. He was recruited by Vail Summit Orthopaedics to elevate the level of spine care for a practice that serves one of the most active sports populations in the world. Hiring Dr. Poulter was an important decision for Dr. Scott Robb, a member of the VSO recruitment team and the non-surgical spine specialist at Vail Summit Orthopaedics.
What I was looking for with Dr. Poulter was to bring in somebody who was well trained in the latest, greatest of spine surgical technologies, but also had a good understanding of the tried and true methods as well. We have a very sophisticated patient base. They're consumers. They are highly educated. Many of them can go anywhere they want in the country to get treatment. Many of them do research on different types of treatments. So I felt it was really important for us to have a spine surgeon who could provide equal, if not better, care to what a patient could get in a big city, right here in the mountains.
If I'm trying to figure out the best way to treat a patient or the best way to guide a patient, fundamentally I always think, what would I tell someone if they're my best friend or family member? Or what would I do for myself? And if you stay true to those values, the right answer becomes clear.
Dr. Jonathan Feeney is a family physician who's been practicing in the Vail Valley for over 33 years. Dr. Feeney has referred a number of his patients to Dr. Poulter with great success.
Dr. Poulter is exceedingly well trained, and I have confidence that he has the ability to recognize which kinds of patients can be adequately treated up here and which patients need to be referred out because of the ability of the ancillary staff and the services to support the kind of training he has.
Dr. Verdat Deverin was responsible for much of Dr. Poulter's surgical spine training at the University of California, San Francisco Spine Fellowship Program. UCSF is widely regarded as one of the best spine fellowship programs in the nation.
Each year there are 40 applicants that try to get into the program and train with us to learn the extensive nature of the spinal surgeries. And each year, because of the number of fellows that we can train, we only can take 3 fellows a year. Greg actually was one of the best fellows that we ever had, in terms of his technical skills, his knowledge, his patient care, and over the years since his fellowship, he became a really successful surgeon.
Staying current with new techniques is a challenge. It's very easy to rest on what you know. But to stay current, it involves going to frequent conferences, but also continuing to teach these new techniques, visiting with the people that are developing them, and then performing research to make sure that they're performing the way that they should.
Dr. Poulter is not only involved in researching minimally invasive spine surgery techniques, he also travels regularly throughout the nation to train other surgeons in how to perform these procedures.
I've always wanted to find a way of doing a fusion technique that wasn't as traumatic to a patient, such that when the minimally invasive approach that I'm using now came available, I thought it held real promise. I believe in it enough that I think that other surgeons should have the opportunity to learn it. So now I travel approximately 5 or 6 times a year to teach this technique to other surgeons. Not that I have any gain in it other than knowing that I'm helping spread a technique that is going to better the lives of other people, and I'm happy to share that with other surgeons.
That's what I tell my patients, pick a surgeon, not a place or not a procedure. As long as you pick the right person, they will do the right thing for you. And I think that Greg is the right person that I would personally feel comfortable trusting myself and my family on his hands.
I'm often asked why I became a spine surgeon, and at the time when I was in medical school and residency, it seemed like I was picking my subspecialty, but in the end I think it picked me. I also think that it is profoundly gratifying to be able to help someone through such a complex process of spine surgery and see them through to the other side in which they're doing well. And it just seemed that after 14 years of school that if I was going to do something, it needed to matter. And in spine surgery, I feel that what I offer patients matters, and I enjoy that about my work.